All righty. So it'd probably be a good idea to get started, and there's a couple of sandwiches left, like about 8 dozen. So if you're hungry, please go get your bags, put them in there, run with them. But I just want to thank everybody for coming and participating in this, and also, the College of Education wants to especially welcome Dr. Julie Lounds Taylor as the 2018 J. George Jr. and Velma Rife Jones Endowed Lectureship. This lectureship was actually established in 1996 by the couple who were really interested in supporting teaching and research that would benefit youth. So it's very clearly appropriate that Dr. Taylor would be selected this year and asked to join us to give this presentation. Dr. Taylor is an assistant professor of pediatrics at Vanderbilt University Medical Center, and she's an investigator at the Vanderbilt Kennedy Center for Research on Human Development. After completing her Ph.D. in developmental psychology from the University of Notre Dame, Dr. Taylor accepted an NIH postdoctoral fellowship in lifespan family research at the University of Wisconsin in Madison. She later moved to Nashville, Tennessee, where she joined the research team at Vanderbilt University. And there she continued her research in an area of focus which she'll be speaking about tonight, which is the issues of transition of youth who have developmental disabilities, in particular autism spectrum disorder, she'll be speaking about today. In 2014, Dr. Taylor received the Early Career Award from the American Association on Intellectual and Developmental Disabilities, and a year later, she was appointed by the U.S. Secretary of Health and Human Services to the Federal Interagency Autism Coordinating Committee. She has over 75 publications in journals such as the Journal of Autism and Developmental Disabilities, Autism, as well as American Journal of Intellectual and Developmental Disabilities, to name just very few. She's currently serving as a member of the editorial board for the journal Autism, International Journal on Research and Practice, and she's co-chairing as well the Autism Lifespan Research Workgroup for NIMH. We are very appreciative that Dr. Taylor has taken time out of her very busy schedule to be here today and to address such a critical topic that we all are interested in. We also appreciate her willingness to be drug all over town and meet with a lot of different people, various stakeholders in the community, parents and members of the Autism Council of Utah, State Board of Education, Division of Services for People with Disabilities, Columbus Center, and there are several others. And I appreciate all of you coming again tonight after meeting with us earlier in the day. And then thank you for presenting at our brown bag lunch for faculty and students. So we really appreciate, we actually feel like we really got our money's worth, which really is important, right, when you're a college of education. So with that, without further ado, I'm just going to turn over the podium to Dr. Taylor.
Thank you for that introduction, Elaine, and thank you for the invitation. You and Dr. McMahon have both put together just a really lovely trip where I've had the chance to meet with students who are really impressive, and also had a chance to learn a lot about all of the many initiatives that are going on in Utah and in Salt Lake City. I'm going to definitely leave feeling inspired and feeling like I have things to take back to Tennessee with me. We have a lot of work to do in Tennessee, as we do here as well. So I'm going to be talking to you today about the transition to adulthood for youth on the autism spectrum. Oops. And let me just give you a feel for kind of where we're going to go in this talk today. So I'm going to start out by telling you what we have learned from our research on the transition experience. We'll talk a little bit about how this period affects youth on the autism spectrum and their families. And then we'll also talk a bit about whether these difficulties at transition continue over time or whether they abate. I'll talk about this a little bit more later, but the transition to adulthood is a hard time for a lot of people, whether or not you have autism. And so one of the things that we were really interested in is, if we follow people over time, do things get better, or do they kind of stay the same? So we have some data to look at that. So we'll go through that, and then for the second part of the talk, I'm going to talk a little bit about what we know in terms of how we can support youth and families. I'm going to talk a bit about some of the changeable factors that have come up in research studies that may be associated with better outcomes. And then I'm going to talk about the state of intervention research more specifically in this area. So let's get started. So for quite a long time, when we thought about people with autism, this is who we tended to think about, particularly in the media, but also in our research. We tended to think about children, usually cute kids, mostly white, right, mostly boys. This is who we tended to see in the popular press, and this is who we tended to see in our research studies as well. And we've learned quite a lot about ways to support families of young children, and also a lot about early detection and early intervention and things of that sort, and that's all very, very important. But more recently, in the last 10 years, we're seeing an increased realization, I would say, that children with autism grow up to become adults with autism, right? We're seeing increased attention paid to that in the media. These are just a couple of examples. So this was a New York Times story from a few years back that those of us in the kind of autism adult world were pretty excited about because the story was actually on the front page and even above the fold, right? So in a really prominent place. And the reporter really kind of embedded himself in this family of a young adult on the autism spectrum who was getting ready to leave high school, and did a really nice job sort of detailing the challenges that the family was facing and their worries for the future and things of that sort. And there have been more stories, and there was a few years back, there was a 2020 all about a group of, I think, 3 families of young adults who were getting ready to leave high school. You know, but we're also increasingly seeing focus on not only the challenges that young adults with autism face, but also, you know, some of the unique characteristics that they may bring to the workforce and some of the strengths that they may bring. We've heard a lot about kind of visual spatial strengths, but also strengths in terms of being great employees if they're put in the right circumstances. So we're starting to see more of a balanced picture in the popular press, not only the challenges that they face, but also the contribution that these young people can make to society. We're also seeing increased attention paid to autism in adulthood through federal funding agencies. And as we know, if there's funding there for research, then researchers are going to move in that direction, meaning that we can learn a lot more. This is just an example of the strategic plan from the Interagency Autism Coordinating Committee. So this is a federal advisory committee that advises the U.S. Secretary of Health and Human Services about priorities for autism activities, mostly research. Now it's research and services. And in 2011 was the first time that you see any mention of adults and adulthood in the research plan, and requests for proposals have come out of this. And so now it's really on the radar of these agencies that are funding research to really be thinking about research that's going to inform how to support adults. But prior to that time, it was really difficult to get research funding in this area. It just really wasn't on the radar. It didn't reach the level of priority of some other areas. So why are we seeing increased attention focused on autism in adulthood? And the first reason is that we are seeing more young people with an autism diagnosis who are leaving high school. And let me say, I'm wording that fairly carefully because we don't really know whether this increase in autism is an actual increase in autism or an increase in children who are getting an autism diagnosis, right? But for the purposes of this discussion, that actually doesn't really matter, because if somebody's coming out of a high school with an autism diagnosis, then they're going to potentially be eligible for services. And so what we see, you know, right now the people who were diagnosed and who would have been in this cohort in about 2004 to 2006 are leaving high school now. But we see that there will be more and more people coming out of high school with an autism diagnosis who potentially will be eligible for services and supports. But yet our adult service system is really underfunded and unprepared to meet the needs of the adults that we have now in the system, much less the additional individuals who will be coming out with an autism diagnosis. And this realization, sort of people call it even like a service crisis, is something that is getting more and more attention, and people are realizing, my goodness, we need to do something about this, which is spurring research into adulthood. Kind of related to that, we're also seeing more and more recognition of what people call the services cliff. And because of the Individuals with Disabilities Education Act, services are mandated while people with disabilities, including people with ASD, are in high school. But there is no such mandate after high school exit. So basically, no matter where you live in the U.S., I've actually yet to find a place where people say, you know what, it's actually about the same difficult, you know, we can get about the same services that we can get now out of high school as we did when we were in high school. It seems to be fairly ubiquitous that no matter where you live in the U.S., getting services after somebody leaves high school is harder. Now in Tennessee, this cliff is very big. Our adult service system is extremely underfunded. In other places like New Jersey, the service cliff might be a little bit shorter. But no matter where you live, there's a cliff. And adult services are difficult to access. They're underfunded. That's not the only issue. They're also really poorly integrated between agencies, so it can be really difficult. If you want to get SSI, you go here. If you want to get voc rehab, you go here. Medicaid, you go here. They're all administered by different agencies. The eligibility criteria depend on each other oftentimes, and it's very difficult to navigate. And also, adult services are poorly integrated with school-based services. And all of this makes services incredibly difficult for families to access. And again, we're seeing more and more recognition of this nationally, which is really moving people towards thinking about how we can support young adults on the autism spectrum, both within the service system, but then outside of the service system as well. And my training was as a family researcher, so I did my undergraduate work at the University of Notre Dame, where I actually worked on a study of adolescent parents and their children, and then did my postdoctoral work at Wisconsin in a study that I'm going to talk about in a moment, where it was a longitudinal study of families of adolescents and adults on the autism spectrum. So in my mind, I'm always thinking about how are families impacted by what's going on in the lives of the young adults? How do young adults affect families? How do families affect young adults in this sort of bidirectional relationship here? So how does the transition affect families? And, not many people have actually done a lot of research on this. I'll show some of our work on this in a few minutes, but people have certainly written about that. One person who's written about this quite a bit is a researcher named Patricia Cowan from the UK. She's really, I think, one of the sort of the leaders, one of the first people to really follow young adults or follow children with autism into adulthood and publish some of the first autism outcome studies. But she wrote about how the transition to adulthood can be really difficult for families because families end up taking over coordination of care after high school oftentimes at the very same time that they're losing services, and services are becoming more difficult to access. So given this background, in about 2004, I went to the University of Wisconsin to start working on this study of families of adolescents and adults on the autism spectrum. And particularly the families of adolescents, when they would come into the study, something that they would say all the time is, what is going to happen to my son or daughter? What can we expect? What's going to be out there for him? What's he going to do? What can you tell us about what will make things easier during the transition years? And so at the time, I thought, well, let's see what we can tell families. And I went to the literature to see what was there, and the answer at that time was really almost nothing. I mean, almost nothing. So this led me kind of down the course of study, at first trying to understand what even happens during the transition years. What does that look like? And then moving into how can we improve the transition experience. So the first research that I'm going to talk about is some of our earliest research in this area, really trying to understand how does leaving high school affect the development and the family functioning of youth on the autism spectrum. And so this is work that I began working on during my postdoctoral work and then have continued to work on. This is using a study called the Adolescents and Adults with Autism study. The PI is Dr. Marcia Malik at the University of Wisconsin, who was my postdoctoral mentor. This is a sample of adolescents and adults on the autism spectrum who were recruited from the community in Wisconsin and Massachusetts. There are a couple of things that make this study just a really, really excellent resource. So the purpose of the study was really to study the parents, the families, and the idea was that these were families who were going to be taking care of their aging parents as well as taking care of their adolescent and adult children. But in the meanwhile, they collected a sample of 400 families and collected data at 7 time points over 12 years. And it just so happened that about 2/3 of the individuals with autism in the study were adolescents and still in high school, and all of them left high school over the course of the study. So we had data on what life looked like and symptoms and behaviors while they were in high school, and then how that changed after high school exit. So that was what we looked at. And so I'll spend a few minutes and walk you through this slide. So the first thing that we wanted to look at was, how were autism symptoms and behavior problems changing when youth on the autism spectrum were in high school? And did leaving high school impact that change in some sort of way? And what we found is that, on average, all of the subscales of autism symptoms were improving while the youth with ASD were in high school. The symptoms were becoming less severe. And this is actually not a surprise. There have been a number of studies, a handful at least by this point, that had shown that autism symptoms on average tend to abate over adolescence and adulthood. They tend to improve. There's a ton of variability around that, but on average, they tend to improve across adolescence and adulthood. But what we found was that that improvement significantly slowed down after high school exit on all of these subscales. And let me kind of walk you through the slide here, because I'm going to put up a few more that look a little bit like it. Oh, let's see. So So this line right down in the middle is kind of the high school exit line. So the lines to the left of that represents change, our estimates of change from our models while they're in high school, while the youth are in high school. The lines to the, I got my left and my right, to the right represent change in high school after high school exit. And for this subscale in particular, repetitive behaviors, whether or not the youth had an intellectual disability was an important predictor of their change. We also, for these measures, repetitive behaviors, higher scores mean more repetitive behaviors, so lines going down means that autism symptoms are becoming less severe. And what we found was that for youth with autism who had an intellectual disability, so this was that red line, behaviors were improving while they were in high school. And that improvement may have slowed down a little bit after high school exit, but not really. It wasn't statistically significant for this group. They kind of stayed on the same path. For youth with autism who didn't have an intellectual disability, however, we saw more rapid improvement while they were in high school, and that improvement significantly slowed down after high school exit. Now, let me just say, we were actually pretty surprised by this finding, and this is going to be a theme throughout my talk. We've had a lot of findings that we're surprised about, and one of those reasons is that, and we'll talk about sort of the intellectual disability versus not thing in a moment, but change is really, really, really hard to predict, really hard to predict. So the fact that across all of our subscales, leaving high school predicted change was actually a big surprise to us, because usually what happens in our models, and we're using multi-level models for anybody who's interested in that, is that we can find a whole bunch of things that predict where people start out, and hardly anything that predicts change over time, even if we can see it. So this is actually a little bit of a surprise to us that leaving high school actually did predict in the way that we thought it might. We also looked at behavior problems. So we looked at kind of more internalized type behavior, so withdrawal, anxiety, and depressive type symptoms. We looked at externalized behavior, so more acting out symptoms. And we saw the same pattern that we saw for autism symptoms. So we found that on average, all the subscales were significantly improving while the youth were in high school. Again, this was not a surprise. Other studies have found this too. But we found a significant slowing of improvement, particularly for subgroups on these variables after high school exit. So the slide is similar to the last one, except for these analyses, family income actually played a part and mattered. So if we walk through this again, the red line, again, represents people with autism, our estimates from our model, people with autism who did have an intellectual disability. You can see their scores on internalizing behaviors are improving while they're in high school. That improvement significantly slows down after high school exit, and really, if you average over this dotted and solid line, pretty much stops in these. And for people with autism who don't have an intellectual disability, we see a much more rapid improvement while they're in high school and a greater slowing of that improvement after high school exit. Now, for this set of variables, actually, family income also mattered. So we saw the greater slowing of improvement for youth whose families had lower incomes relative to youth whose family had higher incomes. I'll talk more about that in just a minute. So then we were also interested in looking at family variables. Again, this is something that's just kind of my bias when we're looking at these things. So the first variable that we looked at was maternal burden. And let me just say, maternal burden is a terrible name for a really great measure. And I keep thinking about, do I need to change the name on the slides, because it really sounds awful, but that is the name of the measure. And really what it is a measure of how hard parents feel like it is to parent their son or daughter. And really when it gets down to it, it's kind of the sacrifices that they feel like they're making to parent their son or daughter. So I played around with, do I call it sacrifices? Do I call it, I don't know, but I just keep it at burden with the proper caveats. So what we found, there we go. So what we found was that when the son or daughter was in high school, parents were reporting that it is easier to parent their son or daughter. And this was the case across intellectual disability or not, across different incomes. But then after high school exit, parents are reporting that it's getting harder and harder to parent their son or daughter, again, at the same rate that they were seeing improvement before. We looked at relationship closeness. This is a measure from the parents, from the mothers, and if they actually rate how close they feel to their son or daughter, and they rate how close they think their son or daughter feels to them. Now, it would have been really nice to have a measure from the son or daughter, right, to say how close, but that's not what we had for this. And what we found, actually, service needs mattered here. So low unmet needs means parents were saying, you know what, here are the services that we need, and we're actually getting most of them. And if parents said that, then we see improvement in closeness in high school, and that improvement continues at the same rate after high school exit. But if parents said, you know what, here are all the services that we need and we're only getting a few of them, then what we saw is, again, the same level of improvement in high school, but a slowing of that improvement after high school exit. And the last one that I'll talk about here is warmth. And this is an interesting measure. This comes from the 5-minute speech sample. Are any of you guys familiar with that? Yeah, so it's from the mental health world, and they've used it a lot in families of people with schizophrenia. And you ask the parent or whoever to talk about their son or daughter for 5 minutes uninterrupted, which is, for some families, is really, really easy, and for some people, it's really hard. And sort of the qualitative data that you get from that is fascinating, by the way. But then we send it out to someone who has decades of experience coding for something that we call expressed emotion, and it's a measure of the family climate. So you get kind of criticism from that, you get over-involvement, and you get warmth. And actually, expressed emotion is one of the leading predictors of whether somebody who has schizophrenia relapses after leaving treatment, which is kind of interesting. So we've looked at that in autism samples, and warmth in particular, again, we saw an effective high school exit. So for youth with autism who have an intellectual disability, you see that warmth is staying the same while they're in high school, and it begins declining somewhat after high school exit. If they don't have an intellectual disability, then we see greater improvements, but also a greater negative effect of high school exit on change in warmth over time. So what this says to us, at least, is it actually confirms with our data what families had been telling us all along, which isn't it nice when data confirms what you see out in the world, that leaving high school is, in fact, a significant turning point. Now, at the time, this is really one of the first studies to look at leaving high school in this way, the first set of studies. But it was by no means even close to the first study to show that transitions are hard for people with disabilities and for people with autism specifically. And one example is a study by Anna Esbenson, who was at Wisconsin when I was there. And she looked at how behavior problems changed after a series of different transitions for youth with intellectual disabilities. And what she found was that whether it was moving out of the parental home, whether it was all kinds of different transitions, behavior problems tended to worsen for a time after those transitions. So the way that we're interpreting this is leaving high school is one such significant turning point or transition that really does seem to kind of mess with the trajectories of symptoms and behaviors over time. At the time, we had some hypotheses for why we expected these changes. And remember, we were doing these analyses around 2009, 2010, so there really wasn't a whole lot of data out there at that point in time about adult outcomes. But one of the ideas that we had was perhaps sort of the slowing of improvement after high school exit is related to difficulties finding appropriate vocational activities after leaving high school. And in fact, that does seem to be the case, and we by no means are the only group or the first group to find that. But I'll just put up one study here that I think was a nicely done study that I had the opportunity to be involved with. This is a study headed by Paul Shattuck, who's now at Drexel University, and he used a study called the National Longitudinal Transition Study 2. This is a nationally representative sample of youth receiving special education services, and then funded by the Institute of Educational Sciences, by IES, and then they followed them up over 8 years. So you could look and see what are people doing after they leave high school. And what we found, we compared young adults and youth with autism to youth who had other classifications that overlapped with autism to some extent. So speech-language impairment was one of the groups that we looked at, learning disability, and intellectual disability. And this was their primary classification within the school system. And what we found, I thought what was most interesting here was this bar down here. And what we found was that about 35% of the young adults with autism, and this was on average about 2 years after leaving high school, had never been involved in paid work and had never gone to college after leaving high school at any point. But I think the more important point here was that that number was significantly larger than any of the other groups that we looked at. And of course, a number of other researchers at this point, even before but after, have shown that employment and post-secondary education is hard for people on the autism spectrum. So we think that that probably has a lot to do with why we see slowing of behavioral improvement after leaving high school. We saw less improvement after high school exit for those whose families had lower incomes. I think the really interesting point here is that we didn't see any effect on income while the youth with ASD were in high school. We only saw it after high school exit, which I thought was sort of interesting. Maybe that means the IDEA is working, at least to some extent. And again, this is by no means the first study to show that lower income is related to barriers for service access. There are a number of studies that show that, for diagnosis and for early intervention services, having a lower income can be a real barrier. And I think the study suggests that potentially for adult services, that can also be the case. Again, not a huge surprise. But what was more of a surprise to us is that we saw less improvement after high school exit for those who did not have a co-occurring intellectual disability. This is actually the opposite of what we would have expected from the existing literature. So the studies that were out there tend to show, and still show, that if you have an autism spectrum disorder and if your IQ is higher, if you have better early language, you tend to have more independent outcomes on average. But what we wondered at the time was whether we weren't seeing sort of a bimodal distribution here, where you might have a group of people who are working independently but you may have a group of people that aren't able to get the services that they need, that are not doing anything. So we actually looked at that. And so we took a smaller sample. This was, I think, 76 youth who had left high school within the last 3 years from this larger study. And we looked to see what were they doing, how were they spending their time. Now, this was data collected. Most of it was between 2004 and 2007 in Wisconsin and Massachusetts. And you can see here that sort of the options and the structure of vocational activities have changed a lot since then. So let's take that with a grain of salt. But we saw that for those on the autism spectrum who had an intellectual disability, the vast majority of them were spending their time in more sheltered, segregated settings, whether that was sheltered workshops, adult days. We found, at least in Wisconsin, people tended to flow back and forth between those two. They'd be in a day center, contract work would come in, they'd go to the workshop and work for a little bit, and then back to the day center. But that was a really common vocational activity. Most people were doing something. So the red slice here shows people who had no daytime activities, and that was reasonably rare in this sample. Now, for the people with autism who didn't have an intellectual disability, we saw a lot more people going to college, working in the community, but this group was 3 times more likely to have no vocational or educational activities at all. So we thought, if people with autism without an intellectual disability are having a hard time fitting into the existing service system and are having a harder time getting the services and supports that they need, maybe that has something to do with why they're more negatively impacted after high school exit. Okay. And so this led us into thinking, once we and other people had shown that there were difficulties at transition, we wondered, okay, so how worried should we be about this? And I'd come up with a number of different examples at the time that had come across my way of people without autism who were also having a really difficult time at the transition to adulthood after leaving high school and going to college. And it made us wonder, how worried should we be about the transition years? Is it that we're really shifting someone's trajectory at this time, or is it that things will get better if we wait? So this is my relatively poor graphic to try to demonstrate something. At some point, I'm going to actually make this a little bit jazzier. But we went back into developmental theory to think about how should we be thinking about these trajectories and how they might shift during transition points over time. And so this is a study, or this is sort of a theory that's been out there quite a bit about change in developmental trajectories. And they talk about 2 different ways that kind of inflection points or transition points can change trajectories over time. And the first is called a momentary perturbation. And so that's when you see improvement, and then the transition happens. And things may drop off for a while, things may level out, things are kind of hard. But if you just follow people over time, they sort of gain their footing, things settle down a little bit, and then we go back onto that trajectory that we were on initially, which is different than a shift in trajectory. So that's when you see things are improving, then the transition happens, like leaving high school, and that improvement stops and it remains flat. So in this larger longitudinal study that I was talking about, we had 10 years of data, and we had data on vocational activities over 10 years. So we thought, well, let's look at this. Let's see if people tend to be on upwardly mobile trajectories over time, if people tend to be on flat trajectories, or even sort of declining trajectories in terms of vocational independence. And that tells us how concerned we should be. I mean, if we kind of wait things out and people go back on upwardly mobile trajectories, it doesn't mean that we don't work really hard to make the transition years smoother and a better process, but we maybe approach that in a really different way than if we see a shift in trajectory that kind of ends up being flat over time. So for this is using that same larger longitudinal study. In this first set of analyses that I'm going to talk about, these are mostly adults who had an intellectual disability, 161 total. And it actually took us a really long time to figure out how to deal with employment. And I'm going to talk about this more in a minute, but once we started digging into this, we realized that sort of the variations of how people were spending their days seemed almost limitless. So trying to figure out how to kind of condense this down into something that we could do something with quantitatively, but actually ended up taking us quite a while to figure out. And what a lot of people have done is they've, broken things into like employed or unemployed, but in our employed group, we may be comparing apples and oranges. Somebody who's in a sheltered workshop making $1.25 an hour to somebody who's working a full-time job. And so we spent a very, very long time coming up with sort of this, we call it the vocational index, a measure of how independent a certain position is, based on the data that we could gather, with the lowest score being somebody who's doing nothing, right, no daytime activities, the highest score being somebody who's working in the community without supports or who is in a post-secondary educational program, and then supported employment is a little bit less than that, sheltered settings, and I'm happy to talk more about the specifics of that if you're interested. But we came up with this measure of vocational independence and then looked to see how that was changing over time, over the 10 years. And what we found was that on average, vocational activities across the sample were becoming less independent over the 10-year period. The predictors of where somebody started out were not particularly surprising. So if the person on the autism spectrum had an intellectual disability, their scores were starting out lower, less independent. A lot of the behavioral variables mattered, so behavior problems, adaptive behavior, autism severity all mattered a lot. None of the services or support variables actually predicted where people started out in the study, which is sort of interesting. And there was only one factor that predicted change over time, and that was whether the person with autism was male or female. And again, this is one of those things that was sort of a surprise because we put sex in as just a control variable. Like we should probably throw that in there and account for it. And it was the only thing that predicted change. And what we found was that for the men, there is a decline in vocational independence over time, but there actually is quite a lot of stability. We don't see a whole lot of evidence of upward mobility, actually, but we see a lot of stability. But for the females, for the women, we saw a great decline over time of almost 1.5 points on the 9-point scale. So we saw a much greater decline for males than for females. This point at the beginning was not different. This was not statistically significant in terms of where they started out, just in change over time. Now, this was mostly a sample who had an intellectual disability, and actually a 4 on the scale are people who are spending all their time in sheltered settings. A 5 on the scale is people who are spending their time in sheltered settings and also doing some work out in the community. So we were interested in trying to see if this pattern is similar for a sample of adults on the autism spectrum who may be spending more of their time in the community. And so we ran analyses looking at 73 adults with ASD who didn't have an intellectual disability. And again, we had data on employment and post-secondary education at up to 7 time points over 12 years. And what we did was group these young adults and adults into 3 different categories. So the first were the ones who were consistently employed or in college. And these are the people who, at every time point that we had data, they were either working in the community or they were in college. And about 25% of the sample fit into that group. The second were people who, at some time points when we saw them, they were working or in college, and at some time points they weren't. Most often they weren't doing anything at those other time points. And that was 43% of the sample, and then about 1/3 of the sample were never working or in college across the study. So then we looked to see how those percentages and how those categories differed by sex. And what we found was that just over 30% of the males were consistently in college or working in the community, and none of the women were doing that on a consistent basis. Now, this is a small sample, so there were 73 to begin with, and I think we had about 24 women in there. But regardless, if we would have expected 1/3 of the women, we should have seen some women there, even with the small sample, and we didn't. We saw none. And again, when we looked at just what they were doing at the first time point after leaving high school that we had, and I should be doing this over here too, I'm sorry, I feel like I'm ignoring this side of the room. There were no significant differences in where they were starting out. It was just in these patterns of employment and post-secondary education over time. Oh, and I'll say this in just a moment, but just in case you're wondering, we also looked to see, well, maybe the men and the women are different. Maybe they're bringing something different to the table. Maybe the women's autism is more severe, their autism symptoms. Maybe IQs are different, adaptive behavior. Maybe things are different with their families. And in both of these different subsamples, we looked for sex differences in basically every single thing that we could think of, and there weren't any. So what this is telling us, at least, is that, in fact, difficulties after high school do not appear to just be a momentary perturbation. In fact, these difficulties do seem to maintain and perhaps even worsen in some cases throughout adulthood. even for adults on the autism spectrum who didn't have an intellectual disability, maintaining a job or an educational program was difficult. So about 2/3 of these young adults were working or in college at some point in the study, but 25% were doing that on a regular basis. And then the sex differences finding. So we didn't find sex differences in obtaining a job or getting into college, but instead in maintaining that placement over time. We saw similar findings for both a lower IQ and a higher IQ subsample, although admittedly both from the same larger sample, so that's important to keep in mind. And again, we didn't see any sex differences between the groups in any of the functional or family variables that we looked at, so that didn't seem to explain what we were seeing here. So we've been thinking a lot, and I know I've talked about this today at some of our meetings, about why. Why is that the case? There really is very, very little on sex differences during adolescence and adulthood, mostly because a lot of our samples have been small. And so if you have a small sample and then you try to pull out the women from that sample, you just don't really oftentimes have enough to say much of anything about them. Maybe it's that autism manifests a little differently in women than in men, which makes it more difficult to maintain employment. Maybe there are different parental or societal expectations for work for women. Maybe if a woman is having a harder time in a job, parents feel like it's more okay for them to kind of take a break, maybe less so than for a man. None of these were parents. Actually, that's an important thing to note, too. I mean, that's something that you might think of right away, but none of the people in the study were parents. This could be just good old-fashioned gender discrimination in the workplace. A hypothesis that we've been kicking around a bit is that it might be that given sort of the gender norms for socialization, it might be that the exact same autism symptom, specifically symptoms around social impairments, might actually be more impairing for a woman out in society than for a man. So we're kind of thinking about this a lot. We've actually gotten an R03 grant, a small grant, to take 3 big data sets and just really explore them carefully for sex differences. So one of them is a study of 600 high school students with autism. One of them is a study of self-reporting adults on the autism spectrum, about 400 of them, an internet survey. And then one of them will also be looking at medical records to look at sex differences, not only in physical health conditions and mental health conditions, but also in access to care, which I think could be really important. So more to come on that. But what our hope is, since there's so little out there in this arena, and it could potentially be really important, we're going to kind of mine these data sets and hopefully come up with some sort of theory or idea for how this might all fit together that then we could explore in a more systematic way down the road. I shouldn't say, that we could examine, forget the explore, and examine in a more systematic way down the road. And before I move on to thinking about how we can improve outcomes, I just wanted to spend a few minutes talking about how we define outcomes. And let me just say that I think as a field and as researchers, and myself certainly included in this, I think there are some things that we haven't done very well. And I think it's because they're really hard things to do. So one is that I think oftentimes our outcomes can be simplistic enough that it's hard to know what you have. And the example that I said before is the employment example. And again, as we got into the employment work, man, it got really hard because you had people who were working in family businesses and they weren't getting formal supports necessarily, but it seemed like they were getting support. Somebody who was a touring musician but needed their family there with them, people who are starting their own businesses, people who, all variations of sheltered work and sheltered and non-sheltered, people who had people coming into their homes to take them out for more recreational activities during the day, and on and on and on and on. People who are working 2 hours a week and people who are working 40 hours a week. And to try to put this into some sort of meaningful quantitative variable was really complicated. So I think what we often do is we simplify it down. And I worry sometimes that we simplify it down so much that we don't really know what we have at the end of the day. Also, a lot of our knowledge on adult outcomes comes from kind of a snapshot in time. So there's very, very little longitudinal research on adult outcomes. And so we learned a lot about if you happen to catch somebody in 2012, are they working or are they not? But we have some data, which I can talk about at the end if you're interested in. I didn't put it in here, showing that actually in a little tiny sample, the factors that predict someone keeping a job are completely different than the factors that predict someone getting a job in the first place. And unless we follow people over time, we can't really learn about that, right? Or we could maybe do some retrospective data collection, but it's really hard to learn about that unless we follow people over time. Even our indicators for special education about, getting a job and going to college, it's really about getting that job or going to college and less about keeping that job over time or being successful in that college program. We just don't know very much about that. And I'm also thinking a lot lately about how do we individualize outcomes? How do we decide what an outcome should be? And really thinking about that. And as researchers, we sort of have to decide that in some way or another, because you have to know, what you're trying to correlate with. But for employment, for example, is having a paid job in the community for 20 or 30 hours a week, is that the top priority for everybody? Maybe, maybe not. We run into this with living situations, living independently versus living at home. I think social relationships is something that we need to really think about in terms of what somebody wants and outcomes. Some people are doing some interesting work with goal attainment scaling in this, where somebody on the autism spectrum defines their goals, and then you see to what extent they're met. There's a lot of movement towards thinking about quality of life as an outcome that we think a lot about. So how does somebody feel about their life? I don't know if that's enough on its own, because if somebody is really happy with their life, or they report that they are, but they're sitting home and playing video games all day long, I don't know. Maybe there needs to be some sort of community, contributing to the community piece of that. I'm not sure. And so what I end up doing in my research is kind of, again, simplifying oftentimes, but I don't know that I'm really necessarily always capturing the important things. But it's really important, I think, to grapple with this, because what we decide are the important outcomes really determines what we try to intervene in, right? And so I think it's an important issue. And I think oftentimes, we decide what the outcomes are, and I don't know that we always get it right. So something that I'm thinking a lot about, and I don't have the answer to that, but I think we grapple with that quite a bit. Oh, so here's an example, just thinking about what outcomes should be. And so something that we had been thinking a lot, so I kind of fell into the employment work a little bit. I was really interested in thinking about adult outcomes more broadly, and then we started digging into just looking at employment, and it got so complicated so quickly that I ended up really landing there for quite a while in the work that we were doing. And after I spent a couple of years really looking at employment, I started to wonder, do I really think that employment matters more than other things? Is this something that is really important? And there are a lot of reasons to think that employment is important from a human rights perspective. Letting people participate in the community and contribute to their community and have the opportunity for financial independence, right, or at least more financial independence. But there really hadn't been any research on whether employment is important or not. So we thought, well, let's just look at this and see what we have. And so we used our vocational independence measure that I was talking about. And then we looked at a number of behavioral variables about 5.5 years later. So we looked at autism symptoms, we looked at daily living skills, and we looked at behavior problems. And we looked to see if having a more independent job was related to more improvements in behaviors over the next 5.5 years, or if the relationship was the other way. So we did kind of this bidirectional model looking to try to tease apart directions of effect. And what we found actually was the more independently somebody was working, the greater gains that they had in terms of their autism symptoms, so that would be declines in autism symptoms, declines in their behavior problems, and improvements in their daily living skills. So this led us to think, okay, this actually does seem to be important. If you put somebody in a position that's challenging to them, that's a good fit, this actually, we see improvements in their behaviors down the road. Now, interestingly, we tried to do the same types of analyses with social participation, and this was really just a gross measure of how much time somebody was spending in the community with friends, doing community activities, and we did not see that same relationship at all for social participation. And what this tells me is there probably are some people, and there certainly are, some people on the autism spectrum that being out in the community and their social participation is very, very, very important to them. And then there may be some people where it's less important, and I think it's important to think about that when we define outcomes. But again, we don't have a whole lot of data on that, to be honest. Okay. So now I'm going to move on to thinking about how we can support youth and families and what we know from our research about that. Okay. So the first I'm going to, there have been a number of factors that have come up here and there in studies about changeable factors that might improve outcomes. Now, most of what we know about factors that improve outcomes are not changeable. So a number of studies have found that if you have a higher IQ, you're going to have more independent outcomes. Well, that's good to know in terms of maybe being able to identify people that might struggle more, but there's not really anything that we can do about that. Same with early language. That comes out a lot in studies, and that's helpful maybe for somebody who's in early childhood, but once somebody gets to be a little bit older, there also isn't really much that we can do about that. But I think there are a few factors that we at least have some tentative evidence about, that I think if I had to put my money on something, and I was talking about this earlier today, these are the things that I would put my money on. Now, I think the thing that's really important to note for kind of these set of factors here is all of the relationships here are associations. They're not causal. So, you know, there may be, for example, I'm going to talk a little bit about daily living skills and its relationship to employment outcomes. But there might be something that's driving that relationship that we're not even measuring, where if you change daily living skills, it actually doesn't do anything because we're not addressing the actual causal factor, which is why we need intervention research. But regardless, let me tell you about what we think we know from our correlational studies. Okay, so the first way that if I had to put my hat on something that will improve outcomes, it would be to improve daily living skills. So daily living skills are these really kind of nuts and bolts, practical set of skills that allow somebody to kind of maneuver through and live their daily life. So this can be everything from being able to toilet oneself, to being able to prepare food and prepare meals, to being able to take either public transportation or your own transportation to get somewhere, to balancing your own checkbook. Hygiene fits in here, money management, all of these things are part of sort of the daily skills that everybody needs to be able to navigate their world and their life. And what tends to happen in almost all populations is daily living skills and IQ track really closely side by side. And so this measure that I have here, both of these measures, the IQ and the daily living skills measures, both have means of 100. So what you would expect to see in most samples is if somebody has an IQ of 85, you would expect their daily living skills to be around 85. Now, there's going to be some variability there, but kind of on average. If their IQ is 115, you would expect daily living skills to be around 115. But that's not what we tend to see among individuals on the autism spectrum. So this was a study done by Amy Duncan at Cincinnati Children's Hospital and Summer Bishop, who's at University of California, San Francisco. They took a large sample of children and youth on the autism spectrum, and they looked at their IQ. They broke them up into 3 IQ groups. So people who had IQs between 85 and 99, 100 to 114, and 114 and greater, and looked to see what their average daily living skills were. And you can see that as IQ goes up, we don't see that same increase in daily living skills. And by the time we get to the very high IQ group, we're seeing almost a 43-point difference between their IQ and their daily living skills. So we think, at least, we feel like we know that daily living skills are related to better outcomes, and this is also a particular area of challenge for many individuals on the autism spectrum. It's also something that we don't teach very well, I don't think, and we were talking about this earlier today, but if in a lot of places, certainly in Tennessee, and I think it's the case most places, if somebody on the autism spectrum is mainstream, if they're spending all of their time in general education settings, they're probably not getting any daily living skills instructions in schools. And when they go to college, unless they go to a college that has some autism-specific supports, they're probably not going to get any training in that in college either. And so this is something that I think we can do a better job at. And there are some researchers out there that are starting to test out daily living skills interventions. And it'll be interesting to see if sort of improving daily living skills leads to more independent outcomes. But I think it will. If I had to put my money on it, I would bet on that. So that's one area that I think we can do a better job at that I think will improve outcomes. Okay, the next area is co-occurring mental health problems. And so anxiety and depression, more and more studies are coming out to show that these are very, very common among youth and adults on the autism spectrum. I know some recent work has come out from here, from Bill McMahon's group, showing that in your study, you're also seeing very high rates of anxiety and depression. It's almost ubiquitous. In most studies, we're seeing that now. This is an analysis that I worked on with Kate Gotham at Vanderbilt. We were actually really interested in co-occurring mental health problems, so we measured it a whole bunch of different ways, because the way that you measure it also matters a lot in terms of the rates that you get. And then we broke the sample up into youth who had clinical evidence of symptoms. These were youth who met criteria on a DSM diagnostic interview, had really severe symptoms. A lot of our clinicians said, I would actually probably diagnose somebody with autism at a threshold much lower, or with anxiety at a threshold much lower than this. So that was our clinical group on both. Then we had a subthreshold group. They had to have at least 2 indicators to be in this group. So maybe history of an anxiety diagnosis from a professional and a self-report of anxiety symptoms above a cutoff, for example, would be 2 ways that someone would get into this group. And then we had the no evidence. And this, actually, I should say no or little evidence, because they could have met on one of our different criteria. But if they didn't meet on 2, then we didn't. We also didn't want to over-pathologize the sample as well. And what we found was that 25% of the sample had evidence for clinical mood symptoms, and 25% had evidence for clinical anxiety symptoms, and only one person overlapped between those two. So about 50% of the sample had significantly impairing mood symptoms or anxiety symptoms. And when we put the clinical and the subthreshold together, only about a third of the sample had little to no evidence of mood or anxiety symptoms. There actually hasn't been a lot of work looking at how co-occurring mental health problems impacts outcomes in adulthood, which I find to be really surprising. But we've had some studies of behavior problems, which are sort of similar, and have found that that does affect employment over time. And so this is something that I think we can do a lot better about. And I know that there are a lot of barriers to adults on the autism spectrum accessing appropriate mental health care, the biggest one being a lack of providers to actually do that. That is something that I actually am hopeful is going to change over time. There is a lot of energy nationally, and I would say internationally, around understanding sort of the significant anxiety and depression that many of these individuals have. And people are talking a lot about what we can do to make that better. Now, whether that's actually going to translate into action remains to be seen. But there at least is a lot of action and a lot of thought about this recently, which I hope will relate to better, that will end up in better mental health care for these individuals. But that would be another thing that if I had to hang my hat on, I would say I think that this will probably improve outcomes, properly addressing these issues and mitigating some of the mental health symptoms that we see. The last thing that I'm going to talk about that I feel fairly confident will improve outcomes is better access to services. And again, some of these things are no-brainers, but this is sort of where our research is at this point, to be honest with you. Probably one of the best established findings in adult autism, I would say, is that people are not getting the services that they need. I remember going to IMFAR, to the International Autism Meeting, and there may be 40 posters on autism in adulthood, and 35 of them will be about services and how people aren't getting the services that they need. I mean, this is something that we find internationally across. No one's getting what they need service-wise. And that's one issue, and that is a really big issue. But the other issue is that it's incredibly hard to access what is there. And so this is just kind of showing complications. There are services related to housing and financial support and post-secondary education, conservatorship, employment, special needs trust, medical, and secondary education if you're still in school. Many of these are administered by different agencies that don't always talk to each other, although they talk to each other here in Utah, which I feel like it seems to be, at least from this morning, which seems relatively rare. Services often depend on each other, so if you have to get this to get this. If you get too much of this, then you can get, but there's nobody putting that together for families, and it makes it really, really hard to navigate the service system. So I see the issue of access to services is twofold. One being that they're underfunded, but the other being that even when they're there, they're very, very hard to access. But again, all of these are correlational, right? And so to really understand how to improve outcomes, we really need to conduct rigorous tests of interventions and programs. So if we actually improve daily living skills, does that improve outcomes? If we improve mental health, does that improve outcomes? And people are starting to work on that again, but we're really on the front end. So this is just an example of the interventions and the state of intervention research in the transition to adulthood and adult issues. This is a systematic review that I worked on at Vanderbilt through our Vanderbilt Evidence-Based Practice Center. And we did a really, really comprehensive review of the literature to see, in 2013, how many studies had been published since 1980, so over 33 years, treatment studies, so intervention studies of adolescence and young adulthood. And we found 32 studies, which, 32 studies over 33 years didn't really feel like a lot. Spread out over a number of different areas. So we had 8 behavioral interventions, 8 medication interventions, 4 adaptive behavior interventions, and 6 vocational. Most of them were poor quality. We had to go through and rate them based on a really standard set of criteria. And the reasons why many of them were poor quality was because many of them had very small samples. So it's really hard to tell if the characteristics of the small sample that you're going to bring into your study would represent anybody else that would ever do the program, right? Most of the studies didn't have a control group. A lot of them didn't have a control group. So if you saw improvements in something without having a group who you could track similarly that hadn't gotten the program, it was really hard to know if the program was the reason for the improvement that you saw. And actually, even the studies that did have a control group, most of them didn't randomly assign people to each of the groups. They would assign people based on when they came in, or I think most egregiously, there was one study that was a vocational intervention study. And the people who had significant behavior problems, they said, well, they're not going to work in our vocational program, so we'll put them in the control group. Yes, this is true. And then the people that were not in the people in the intervention group did better. You know, but there were lots of studies like this, and this actually reflects a lot of it. Actually, I think more than anything, reflects the lack of funding for these types of studies until recently. Doing a good intervention study is really expensive. And the other thing is that except for drug trials, and again, there were 8 of those, there was very little replication of intervention studies. So there were maybe 2 studies that tested the same type of program, but they were all different interventions. Everybody had different outcomes. And so without any replication, it's hard to know whether anybody else would ever find what the researchers of the original study found. So why are there so few studies? The first I wanted to do is emphasize how few studies there were. There's been a lot of emphasis on early intervention. So the same group in 2011 did a systematic review of interventions for children with ASD. So this is from 2000 to 2011, and they found 183 intervention studies of children. And remember, the adult was from 1980 to 2013, so 11 years versus 33 years, and 183 studies versus 32. So there's been a really big difference in terms of the number of intervention studies for children versus adolescents and adults. I think the interesting thing about that is that in 2014, so 3 years later in the child group, they said, well, let's go back and see if there's enough additional studies to warrant doing an update on our systematic review. So they went back and they found an additional 65 studies that had been done since the 2011 systematic review. And so they said, okay, let's go ahead and do the update. So then a few years later, we said, well, let's see if there are enough additional studies to warrant doing an update to the adolescent and adult review, and there weren't. So the funders said, you know what, we don't think, I can't even remember how many there were, 2 or 3. They said this isn't enough to warrant doing the update. So although this was in 2013, things haven't changed that much until recently, and I'm going to talk about that in just a minute. So why have there been so few studies? And I think until fairly recently, the scope and the extent of need hadn't been demonstrated. So we can talk about how there are significant needs of adults on the autism spectrum, but without having the data to show people that, it's really hard to make the case that this is where limited funds should be spent in terms of research. Yeah, and without demonstrating the scope and extent of need, it's really hard to get research funding. But that is changing, and that is changing really rapidly. So I just have a couple examples here. So for example, Autism Speaks, their research program has really kind of been under the radar for the last little while, but they're ramping back up now. And so they put out a strategic planning survey for science that anybody could fill out, researchers, parents of people on the autism spectrum, self-advocates, providers out in the community. And their very top responses for research priorities were health and well-being, lifespan issues, associated conditions, and transition to adulthood. Those were the 4 areas that came out more than anything. And they're actually planning on putting resources towards these areas, mostly towards intervention studies. So if anybody's interested in interventions, keep this in mind, keep checking their website. But, again, they're taking note of this, and things are changing. Also, again, the Interagency Autism Coordinating Committee really has made a point to be thinking a lot about adult issues. Specific RFAs have come out for grant proposals focused on interventions during the transition to adulthood and has really actually pushed people into the transition world to be testing out new programs. We got one of these grants. I actually wasn't necessarily looking to become an interventionist, and I thought, well, let's give this a shot. And there are lots of other people who were maybe doing childhood research, and they thought, well, there's some money here for this, so let's really think hard about how my intervention that I've been working on might apply during adolescence and adulthood. So it's been effective, I think, in spurring research in this area. And because of this increased funding, there are a number of ongoing funded interventions going on in this area that we're going to hear more and more about as these studies get further along and the findings get pushed out. This is just a handful of the ones that I know about. There are many more. But there are studies focused on employment skills, including soft skills, interviewing skills, using all kinds of different techniques, some face-to-face, some virtual reality interviewing skills platforms, social skills interventions that people are developing that seem to be really nice, cognitive behavioral therapy for mental health problems, so treatments for mental health problems that aren't just medication, right, thinking about other means, but also medication management, and this is a significant issue for adults to be independent, being able to manage their own medications, right? Psychoeducational interventions for families, transition planning interventions in schools, self-determination and self-regulation interventions for students, And then our stab at this, which I'm going to talk about for the last little while, which is advocacy training for families to improve service access. Okay, so for the last little part of my talk here, I'm going to talk about our stab at this, our attempt to improve transition outcomes, which is improving transition outcomes through improved parental advocacy. So our program that we developed is called the Volunteer Advocacy Project Transition, which is sort of a funny name. The reason that's called that is because it's based on a program that had been going on at Vanderbilt for quite a long time called the Volunteer Advocacy Project. And this project trains advocates on special education law for school-based children. So what are families' rights under special education law? They train these advocates, and then the advocates go out and work with families, and help them sort of exert their rights that they have under IDEA. So we naively, I should say, thought, well, we'll just take this framework. It's a 12-week program, 2.5 hours a week, 3 hours a week, and we'll just tweak it a little bit to be applicable to the adult service system, which was ridiculously optimistic in terms of how difficult this would be. And so we got the funding, and it took us a very, very, very long time to figure out how do we take all this complicated information about adult services and distill it down into 12 3-hour sessions. So this is a parent training to improve transition outcomes, and it teaches parents about the adult disability services and supports with a real focus on how the different services interrelate and the most effective ways to access them. As it stands right now, it's a 12-week program. Each week is 2.5 hours. And what we do is we bring in experts from the community who are experts in each of these different areas. So, if we're talking about SSI, we don't need me up there talking about SSI. We need somebody in the community who knows the ins and outs and the nuts and bolts of how do you get SSI, right? And so we bring in community experts who really are on the ground and know the ins and outs and have a lot of experience working with families in this area, in these areas. Each week is a mixture of lecture, activities, and question and answer. We actually have been doing it in a group format, and we have some evidence. We've thought hard about how do we develop this in a way that can be accessible to families who can't come to the group. But what we're finding, at least initially, is that the group component seems really, really, really important. Families are networking. A lot of families that we're seeing in our studies don't know a lot of other families who have kids at the same age. A lot of the families are more isolated than what I would have expected going into this. And so families who take more of the sessions in the group format end up having a lot higher empowerment scores. And if families can't come, once they sign up, we'll allow them to watch the sessions from home because we want them to get the information. And the families who came to more of the sessions in person had much higher empowerment scores than the families who didn't. I'll talk more about that in a minute. I'm kind of getting ahead of myself. So here's our approach. So we focus in on parents as advocates. And that is something that we thought really long and hard about because that is not an uncontroversial decision. And there's a real push to, that young adults on the autism spectrum should be taking control of their life, and they should be the ones driving, getting services and supports. And I think that is absolutely true, but at least right now the reality is that parents are the ones who are doing it. And parents are the ones who are coming to us and saying, oh my gosh, we don't know how to navigate the adult service system. Now, focusing on parents also allows us to recruit families of youth across the entire spectrum of functioning, which is something that we try to do whenever we can. So our initial path is to focus in on parents as advocates, although we're thinking hard about how this curriculum and how this type of material might be useful for training self-advocates as well. In parenting during this stage of life, we were talking about this a little bit earlier, this is not an easy thing, knowing when to step in and when to step back and when to let your son or daughter fail and when not to. I mean, these are really, really complicated issues. That's sort of a side note, but it's something that I'm thinking a lot about. We had a family who came into our study, and their son was about 1.5 years out of high school and was in college and had been in the same college program the whole time as we've been following him. And I was excited. I was like, this is our success story. He's doing great. He's getting good grades. And then the more that we talked to the mom, she was calling him and waking him up every morning to go to class. He was coming home every weekend, and they were doing his homework together. And she was writing emails to his professors from his email account on his behalf. And so then I was kind of like, And then the more that I talked to the mom, then I found out that she wasn't doing that stuff initially, and he was failing out. So I don't know. These are really, really hard and complicated issues. And something that I have some colleagues at Vanderbilt who are thinking about trying to put together some sort of kind of how do you parent to foster self-advocacy or self-determination, and I think these are all great things, but I think being a parent during this time of the lifespan is hard whether you have autism or not, but the issues are, I think, especially difficult. But anyway, we focus on parents as advocates. Instead of focusing in, again, on one aspect of the adult service system, we really try to hit all of them to some extent, but with a real focus on how they fit together. So we talk about secondary education, we talk about housing, financial support, post-secondary education, conservatorship, non-adversarial advocacy, so this is an important skill for families to learn, employment, special needs trust. We talk a lot about person-centered thinking, and as we move forward in this program, we're making that more and more of a focus. This next time around, we hope to actually do formal person-centered planning processes with all the families before they come in, so there are really careful, in-depth discussions about the hopes and dreams of the person on the autism spectrum. The families can then use when they're advocating for services, as well as medical services. And in this program, we're trying to target families of youth across the spectrum. And granted, there are going to be some of these sessions that are going to be more or less relevant to certain families. But in general, most of the sessions are relevant to some extent to many of the families that we see. So it's kind of our first pass at this, is to really think about how can we develop something that's really broadly applicable. And so what we've looked at in the study is, first of all, does participating in the VAPT lead to improvements in our primary outcomes, which is parents knowing more about adult services, feeling more skilled and comfortable advocating on behalf of their son or daughter, and feeling more empowered. So these are our intervention targets. If we see this, we're actually, I was going to say we're excited, but we're actually relieved, because if these things don't change, then we probably won't expect outcomes to change. And then our second research objective is then to see, well, okay, then does participating in the program actually lead to better service access and better post-secondary educational and vocational outcomes for the youth on the autism spectrum? So we did a pilot randomized controlled trial. We recruited 45 families of youth on the autism spectrum who are within 2 years of high school exit. So we did a lot of our pretest measures, randomly assigned families to either the intervention group or a waitlist control group. The intervention group took the program. We collected data right after, and then 6 months and 12 months after a follow-up, and then the control group took the program. And so we saw some pretty promising effects of taking the program on our intervention targets. So controlling for where families were at pretest, we found that the families who took the intervention, which were the blue bars here, knew more about adult services at post-test, felt more skilled and comfortable advocating on behalf of their son or daughter, and they felt more empowered, with effect sizes that were pretty big. So a Cohen C effect size of 0.8 is a large effect size, and we're really kind of hovering around that for all of these measures. So we were happy with that, but of course, we're not that excited if this doesn't translate into better outcomes for the son or daughter. And so at 6 months, so 6 months after the control group took the intervention, we looked to see the number of services that families reported getting. And for families in the intervention group, they had a median of 2 services prior to the intervention and 3.5 at our 6-month follow-up, so about a 1.5 service increase compared to 2.5 up to 3 for our control group. And thinking about this another way, about 61% of families in our intervention group increased the number of services that they were getting compared to 35% in the control group. So this is promising. It's not, it's not like definitive by any means, but it says, actually getting families information about services in a digestible way might be enough to move the needle just a little bit. And then the other thing that we looked at is, do we see differences in employment and post-secondary education outcomes based on whether families took the program? And let me just say that this is a subgroup of our group. So the specific request for proposal said that you had to recruit families of youth who were within 2 years of leaving high school. So it's a pretty specific age group. So by the time that we got to our 12-month follow-up, only about half of the sample had actually left high school, even a little bit less. So you can see here that the numbers are really small. We have 6 people in our intervention group and 10 people in our control group. But what we found was that of these 6 families in our intervention group, all of their sons and daughters were working or in college, compared to 50% in our control group. So, nothing definitive by any means, but I think some promising evidence that suggests that we need to look at this in a bigger sample and see if these findings can be replicated among a bigger and a larger sample of young adults on the autism spectrum. It was enough to make us think we should keep going. So So this suggests to us that there is some preliminary evidence that taking the BAPT program leads to improved service access and post-school outcomes. And I kind of mentioned this before. Well, I actually didn't mention this. So we looked to see whether empowerment or knowledge, improvements in empowerment or knowledge seemed to be related to better service access. And it was empowerment. It wasn't the knowledge per se. So, and I think you probably have to have the knowledge about adult services to feel empowered, or at least that helps. But it's not just having the information that seemed to be helpful, but it was really feeling comfortable and empowered to use it, which again makes sense, but that was what we found. But clearly, we need to do more work on this program. We need to test this out. The curriculum that we developed is specific to Tennessee because the adult service system is different in every state, which of course is a significant limitation. So we're thinking about different models that we can develop to develop a program that would be relevant nationally and gather better evidence and better evidence for effectiveness. And then the other thing that we're really keen on doing is to really carefully examine who benefits from this intervention. Is it families of people whose children are more severely impacted that tend to have more access to services, or maybe not? Do families from rural areas not benefit as much as urban areas? Does socioeconomic status play into this? And then that can help us guide what modifications we need to think about making. So to sum up, what we're finding in our work is that the transition to adulthood is difficult for many people on the autism spectrum, certainly not all, but many people, and that those difficulties do seem to persist throughout adulthood. I think that the state of our intervention research is pretty kind of in its infancy right now, but there's hope because researchers and advocacy groups and policymakers are really paying attention to this issue. And I think that that's going to bring about a lot of positive change. And although there aren't very many intervention studies out right now, there are a number of interventions that are currently being tested. And a lot of these are small studies, so the findings are going to be tentative just like the findings of ours are, but I really think we're going to start to move forward. I think in the next 5 to 10 years, it's going to be a really different landscape in terms of what we know about adulthood and specifically what we know about programs to improve transition outcomes for people on the autism spectrum. And I just want to acknowledge my collaborators at Vanderbilt, also my collaborators at Wisconsin that I continue to work with, and students in my lab who have done a lot of the work here, as well as our funding sources. National Institutes of Mental Health funded the intervention research and some of the transition descriptive work, National Institute on Aging, and NICHD. Thank you very much.
So everyone can hear. Sorry. Go ahead.
So in your controlled trial, what was the attrition rate in the control group? Did you use any sort of incentives to sort of keep them engaged?
So for the waitlist control group, we did a waitlist control, which the next time around, I think we'll not do that because that was pretty hard for families to say, okay, we're coming into your study because we want to learn about adult services, and then we say, that's great. In 12 months, we're going to have you come in and hear, but it did keep the control group in the study. So out of the 45 that we recruited, we had 41 that we kept through the post-test. So that was only, that was about it. And then we had 39 that we kept through our follow-up. So we did pretty good keeping families over time. I think what we're thinking about for the next iteration is that what we'd like to do is give families all of the written materials that we go through. And I'm not sure how helpful that will be because it's so dense and it's really hard, but at least they'll have something that they can look at. And man, if we find that giving families written materials actually works just as well as having them sit through 12 3-hour sessions, then great. I don't think it will. But if it does, that's fine. But at least families will have something. They'll have the information, and then they'll still have the option at the end of the study period to go through the full training. So that's kind of what we're thinking for the next step.
I don't need that.
Okay.
My voice carries. I find it really fascinating that, the variables to get a job are not the variables to keep a job. And, sex is not going to change. You can't change male to female. What are some of the specific variables for externalizing disorders, for keeping a vocational job after high school, and compliance in the work setting? Doing what you're told, actually.
Yeah.
Have you identified any specific variables?
Yeah. So we haven't looked at compliance, and actually So we have a small study. So making that statement is based on a small study of 40 families. That's not this one, it's a different one. Because I don't think there have been any other studies actually that have looked at stability and how to predict stability. It's something that we know shockingly little about, I think. But what we found is that the only factors that predicted, so we had a sample of 40 people. We followed them for 2 years after they left high school. And we looked to see how many of them had a disruption in those 2 years. And we had really careful data to say, like, if somebody moved from a 2-year college to a 4-year college, we didn't consider that a disruption, right? Not every sort of incidence of instability is a bad thing. If somebody was moving from a more sheltered setting to a job that had more independence in the community that they felt like was a good fit, we didn't want to, but if somebody got fired from a job, we counted that. If somebody failed out of a college program, we counted that. And 50% of the sample had a disruption over the 2-year period. And the only factors that predicted whether or not they had a disruption were indicators of maternal mental health, actually. And how we interpret that is that families are working really, 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 really hard to support their sons and daughters once they get in these programs. And we've seen that anecdotally. The example that I just gave of the young adult who was in college, and there's another mother who had been working as an advocate in the schools for many, many years. And when her son left college, she quit her job to be able to support him. And this is something that we hear all the time. Families are working incredibly hard to support their kids. And if they're not able to do that for whatever reason, I think that we see the effects of that. They shouldn't have to work that hard, but they do. So that's what, in this small study, that was what we found. And it's really led us to really try to make the case and argue that we need to be looking at this much more carefully and in a much bigger sample, measuring more factors so we can really understand, if that's true. And if we're learning a lot about helping people get into jobs but not learning anything about helping them keep those jobs once they get there, we're probably not doing people very many favors. I mean, the other thing that you brought up that we don't know much about is characteristics of the workplace and supervisors and employers and things of that sort. And that's another thing that we're starting to think about. We're kind of on the front end of that.
I know you said your curriculum was specific for Wisconsin, but for those of us interested in developing a similar program, would you be willing to share that?
Yeah, I think so. And we're actually, the tack that we're thinking about taking nationally is to have sort of a vignette at the beginning that says, like, no matter where you live, this is what SSI is, or this is voc rehab. For some of these topics, the national vignette would probably suffice. For many other ones, it will not, right? And then what each site would have to do is bring in their own local experts, and we would provide sort of a set of bullet points or a set of material that we would like them to cover, that they can cover in their own way. So the first time through, we also wanted to really standardize things. So we developed this really, really standardized set of curriculum, and then our community experts had to come in and present off of our slides, which if anybody's had to do that, that's a terrible thing to ask somebody to do. And so that's the other way that we've tried to kind of regroup this a little bit, is to let people present in a way that they feel comfortable, but to also to try to present some sort of guidelines to make sure that the things that we feel like are important get covered. So we actually have a proposal out right now that'll get reviewed in June, that if that gets funded, we'll be able to develop those national modules and then think about how to do that in a way.
I'm sorry. This is probably a very stupid question, but reading your work on performance indicators and growth indicators, I kept thinking about this. You said people don't look at the growth indicators nearly as much, and you mentioned it today in your talk, which is quality of life, and how you measure that. The stupid part of this question is, it can't be that stupid, because there's a whole edition of the American Psychologist dedicated to research on this. The Martin Seligman issues about looking at templates for happiness for non-disabled individuals, income floor, supportive relationships, specific use of leisure time, control of your life. Has anybody looked at that with high functioning of 100?
Yeah. No one's used the Seligman model for that. And I feel like trying to get beyond these objective indicators to think about some of the more subjective things, again, is just one more thing that is really in its infancy in this area of research. But I'll be surprised if we don't see more of that in the future, because a lot of people are starting to think really carefully about how do we really get at some of these subjective indicators of life outcomes, and I think couple that with the objective indicators. I don't know that necessarily replaces the objective indicators, but it's something that I think we need to be thinking more about. The other thing that I come back to that I'd like to see things move towards is really thinking more carefully about how to improve mental health. I feel like that is an outcome that everybody can get behind no matter what, and you know, I think some additional work in that area to really carefully understand not only interventions to improve mental health, but even just descriptive work to really understand what is related to you know, mental health problems in this group. We don't really, there have been a lot of studies that look at the rate of mental health problems, but there really haven't been very many studies that look at why do people on the autism spectrum have increased. I mean, some genetics work, but in terms of kind of, you know, what's happening in a person's life and how that might relate to mental health problems, not much of that at all.
Looking at the intervention study, were you able to kind of delineate differences between, in the subjects, those individuals with autism, individuals with autism and an intellectual disability, to see if it was successful for that group as well?
So in this little sample, we actually didn't really see any differences based on whether or not the son or daughter had an intellectual disability in terms of service access, improvements in service access, I should say, and in terms of outcomes. But, you know, this was a small sample. The numbers are getting pretty small when we start to divide it down. So that is something that we are keenly interested in looking at once we have a bigger sample. And if we see differences, you know, they can emerge because our power was too low to be able to really see that. But that's something that we're interested in and we attempted to look at and didn't see anything in this small sample. But it's got to matter, right? We had actually thought about also, do we need to have different programs for people that have different, and we at one point we had thought maybe we'll have kind of sort of branching sessions, especially when we're talking about, you know, different types of high school diplomas. And then families said they really wanted to hear about all the options, so we didn't do that. This whole idea of, can you have one program that's relevant across, and do we need to have different programs, and what should we be doing for who, is something that we've really grappled with a lot and will continue to grapple with.
One of the lessons you talked about, like creating that program and incorporating the kids, the young adults. But so in that situation, you feel like it would have to be delineated by with ID or without?
Probably so, when we move in that way. And I'm not sure how helpful this type, the way that we've thought about this more is perhaps coupling sort of the parent service advocacy training with like a self-determination intervention for the young adult. So I can tell you what we tried to do was to really incorporate the young adult in like a halfway sort of way, where they came to a couple of sessions. We did a session on self-advocacy. We did a session where they put together sort of a person-centered, like a dream board, and then we had them. And it didn't work because you can't do these things in a halfway and expect, you know, for that to be helpful. So what we've decided is if we're going to bring in the young adult, we need to really, you need to have a really nice, well, you know, surprise, like a good curriculum and a well-established curriculum. So what we're thinking about is sort of running a concurrent curriculum on self-determination that would go along at the same time. But then a next step would be to really think about, and I think we'd have to do a lot of focus groups and really think about what type of some kind of service advocacy program would be the most relevant and be the most helpful. And I talked about at lunch, I think the other way to take this program that I'm really excited about, and we're starting to partner with people on this, is to actually use this information to train advocates instead of training families. I mean, wouldn't it be nice if families didn't have to master all the intricacies of the adult service system, but instead they had an advocate that they could work with who really understood sort of the breadth of the field and could say, okay, here's kind of your goals, your son and daughter's goals, so let's start working our way through the steps here. So ultimately, that's probably where I think that this curriculum and this program will be the most effective and the most helpful. And then if we take that route, then the advocate could work with, self-advocate could work with young adults with disabilities or work with parents or, you know, or whoever. So we're thinking about a lot of different ways. And another way to take it would be to develop web modules, right? So people don't have to come to the in-group training, even though that seems to be a really effective way to do it. There are some families who just can't do that, right? And so we're really thinking about a lot of different options. So let me think about the ones that, so I know, so if anybody can't hear, she was asking what intervention studies are going on right now. that we can know about. And so just a handful of ones that I know about. So Matt Smith at Michigan, University of Michigan, is doing a virtual reality interview skills training where, and this is something that he'd been doing with adults with schizophrenia for a while, and now he's doing it with young adults with autism, where they come in and they do this interview with this woman named Molly. And I've actually kind of done some of the trainings myself, and then they sort of vary her reactions to the interview questions. Sometimes she's very stern, sometimes she's a little bit more warm, and they can go through the training there. And so he's doing a randomized controlled trial with that to see how that improves interviewing skills, and I think he's also going to measure employment outcomes for that. Sean Eek, hi. That's mostly higher functioning. A lot of the interventions are going to be, right now at least, are going to be focused on people who are higher functioning. I have a colleague, Leanne Smith at Wisconsin, who's doing a parent psychoeducational intervention. So really providing families with information about what we know about autism, but also family problem solving is a big piece of that, like families coming together. They do joining sessions. She actually does run a group for the young adults with autism at the same time next to that, and is finding some nice findings for that in terms of, mostly in terms of parental stress, but also I think a little bit in terms of outcomes. So Sean Eek at Pittsburgh is doing something, I think he calls it cognitive remediation, that really works on sort of cognitive skills that can be difficult. I think more executive functioning type skills and things like that. He's actually one of the ones who's doing a larger scale trial. A lot of these are sort of in small pilot phase. There's also somebody, Lisa Rubel from Kentucky, who I think came and spoke here, maybe not. But she's doing a transition planning intervention where she has families that are coming in and working with special transition coordinators to see if they can improve transition planning in Kentucky. So those are just a couple examples. Susan White is doing some more mental health type interventions and some self-determination around this age group, particularly for college students. She's at Virginia right now, Virginia Tech. So this is active. Lots of people are starting to do lots of things. In San Diego, Mary Baker is doing a couple of different. So there's these pockets of people who are, but most of them right now are fairly preliminary and small-scale trials. But if people start getting nice results, then hopefully we'll see these turning into larger-scale trials, you know, with better evidence that we can think about incorporating in other contexts. Peers do social skills training. There have been quite a few studies that have looked at that, so that's another one.
So your, like the longitudinal data talks about where the service is slow, and the improvement has been slow. When students engage in post-secondary education or employment, do you see, like, is there a subset of that sample where you see those that went to college or those that were involved in employment? Like the improvement continues? Because I know you talked earlier about employment makes certain interventions that gives you some sort of practice. Post-secondary is the same outcome?
So when we talked about, our vocational index, we grouped the employment and the post-secondary education together. I don't think we've ever separated them out, and one of the reasons for that is that this was a sample that was diagnosed, that they recruited in 1998 that had been diagnosed as children. So it's a really different sample, and that's probably something I should have noted at the front. I feel like our samples of adults on the autism spectrum become out of date really fast because what we consider to be autism is changing so rapidly and has changed so rapidly in the last, 15 to 20 years. So this is a sample of people, even the ones who are, quote unquote, higher functioning, they're still reasonably severely affected, all diagnosed as children for the most part. So we didn't really have that many people who were going to college to be able to, a handful, to be able to really pull that apart. So we grouped them together with the people who were working in the community. Now, as people continue to collect data on outcomes and as some of these younger samples start to leave high school, we're going to start to be able to really tease that apart and get some better feel for that, I think. But our samples of people who were diagnosed many, many years ago, it's just a different group, and we see less of all of those types of activities. Except here, in the Utah sample, you guys saw great outcomes.
But I would say our sample was way more severe than the samples if we tried to do that today, because the boundaries of the syndrome are defined more broadly. The most clear example was in our initial sample, the rate of intellectual
Yep, that's the way it is in this sample too with the longitudinal data. So you wouldn't see that today. It would be more half or even less than that, right?
Yes, actually, the registry, Utah Registry for Autism and Developmental Disabilities, if I remember right, about a quarter of
Oh, wow.
all, generally they're 8-year-olds, about a quarter have intellectual disabilities.
So it's a quarter.
3/4 not.
Yeah, yeah. So as more people are doing this work and as these samples are aging, it'll be really interesting to see how much this work that we've all been doing over the last few years reflects what's going on now, and especially with so many kids who are getting early intervention too. You know, hopefully that has an effect. We would expect outcomes to change quite a bit. We'll see. Now I can say in our study, the smaller study of people who just left high school, so we collected that. They would have all left high school in 2014 and 2015. And we saw that most people were transitioning into something in that sample, whether they were going to college, whether they were transitioning into an employment position, or even transitioning into some sort of sheltered setting. We saw very few people who actually left high school and were sitting at home, but it didn't take very long for a lot of those people for things to start falling apart.
Okay, well, thank you. Thank you very much. And